how is the protective gear equipment in your hospital? The hospital level sends its information on cases, death cases, and so on to the government. Is it like, do you send them first to the governor, to the state, or directly to the oh my God, what is it called? The CDC? And have you treated smokers or vapors? Are the symptoms like more stronger in smokers or
COVID is starting to affect hearts more than anything. So it's not just breathing, but it's almost like they're getting some type of infection around their heart.
So potentially, if you do survive that, you will have to get put on a transplant list eventually, yeah?
See, this is brand new to us because the ones that are developing that are dying.
Damn.
They're dying. So, I mean, I don't even know. Okay, so we don't have masks here. We don't have them. And so, I mean, it's even to the point where I like had to buy some off of Amazon the other day. Thank God they had them. So, and that's what a big question is like, once you get it, can you get it again? That's a big question.
nobody's talking about the treatment? Is it also paid, or does it go to the individual to pay it? How much are approximately the costs? Because it's a new thing, relatively new thing.
Mm-hmm.
So
Is shit fucked up and stuff over there too?
in Austria,
Yeah.
no, everybody's chilling.
Man, they say they'll have like a sore throat the last couple of days and their vital signs are good, their breathing's so good. Sometimes they'll just turn them away and they'll be like, okay, go back home. If it gets worse, come back to the ER or call, like a live doctor or nurse. They're really promoting these virtual doctors right now.
Mm-hmm.
But that's where it kind of ends.
Mm-hmm.
Now, if you are a patient that comes into the ER with worse symptoms, then they're going to probably test you.
Mm-hmm.
So they'll have you in the ER for a little while. They'll do your vital signs. They'll see what your course is. They'll send the test. If you're doing okay, you're not on oxygen, then you'll probably go home and you'll get the results and they'll give them a call.
Mm-hmm.
If you're a patient that comes in, you're not breathing well, just doing horrible, then we're going to go ahead and admit you. So they're going to go ahead and do a COVID test right away. Have them in ER until if we're full, they'll keep them there. Or if we have a bed available in the ICU or one of the other floors, then we'll go ahead and admit them and wait until that testing comes in. Originally, the testing was taking like 5 or 6 days. It was ridiculous. And then it went down to 3 days. And just recently, this last week, we got it down to about 12 hours or so.
Mm-hmm.
So they're in our hospital beds. We're waiting for the results. And really, like, what we're doing is we're treating the symptoms. So there's not like a special drug per se, like, okay, you have COVID, here's a cure drug to give it to you. No. If you're not breathing, we're going to give you oxygen. If you have a fever, we're really just going to give you Tylenol. We might give you some fluids if you seem dehydrated, but it's really playing the symptoms. Now, the patients in the ICU I work in ICU, so those patients that get to my floor, they're really sick. They are requiring like high treatment of oxygen, whether it's a oxymask, a high flow nasal cannula, or really we're intubating these patients with a breathing tube a lot quicker than we do the average patient. And what we're finding is that these patients that come in, they're coming with shortness of breath. They might require a little bit of oxygen. And then like hours later, they're requiring a lot more oxygen.
Mm-hmm.
And then even 24 hours later, we might have to put a breathing tube in them.
Mm-hmm.
So if they get to that point, we're doing chest x-rays. So chest x-rays of your lungs so we can see like what it looks like in there, what's causing you to not breathe. And from there, a lot of these patients are developing pneumonias. So if they develop pneumonia, then we go ahead and start antibiotics and see if that works. So that's kind of like what it might look like as a standby that just comes in. Like you might go home and not be tested, or you might be tested and go home, or you might be tested and you're going to stay with us just depending. And we would rather that you go home. We would rather that you go home and not have to stay in the hospital, because then you're at risk also of the patients that are COVID positive or high suspicion of it. I mean, it's a huge risk that they can then develop that disease if they don't quite have it right now, right away. So we do promote going home more than anything. I agree with it. I do think instead of some of the people that come in with mild symptoms instead of sitting at home, I do believe that they should be tested because they came in enough just to, because there was a concern. But unfortunately, there's not all these tests going around, so you kind of have to pick and choose.
Yeah, I'm just gonna explain briefly how it works in Austria, like in general. Like
Mhm.
if you are at home and you then feel some symptoms that you heard on the radio, television, whatever, like sore throat, coughing, and so on, then you contact your doctor because in Austria there's a government-funded healthcare system. So you contact your doctor, explain to him the symptoms, and then he tells you uh, if you're may be positive or not. If he thinks that you have COVID, then you get the test at your home. You test yourself and send it back. And then you're in a constant contact with your doctor if you need to be hospitalized or not. But we are also leaving people at home if they don't have severe symptoms. So it's kind of
Wow.
almost the same or something.
Yeah, it sounds like it's very similar.
Yeah,
It can be.
yeah,
Minus the going to the ER on your own will. Sounds like that's the difference.
yeah, yeah, yeah. On that, I wanted to also ask you, how is the protective gear equipment in your hospital? Because I saw a lot of pictures, especially from the US, like with inadequate protective gear for nurses and so on. So how is it in your hospital? Do you have full protective equipment?
We do have protective equipment as of right now, but it's definitely scarce. And so what we did originally is gosh, we go by the CDC and we go by the WHO, and we base our plan based on what they say. The CDC and the WHO, the World Health Organization, are not always on the same page. So we kind of pick the one that has better protection, at least at the hospital I work at. And so it changes every freaking day.
Yeah, yeah,
Every
I
day
can
it
imagine.
changes. It's crazy. But um what they're doing is we're getting the protective equipment. So if you have a COVID positive patient, you get, your yellow gown so you can protect your body and your clothes from transmission of the virus that way. And then we haven't been using N95 masks as of yet. I know that's a topic in the news lately, but we do have the cappers, and so which I actually like more. The cappers are that it's a helmet that you put on,
Hmm.
and it's connected to a face shield, and so it covers your entire front face, and it fits over your chin. And with that, you plug it into a battery pack and it blows filtered air the whole time that you're in the patient room. So it looks robotic, but it actually is more comfortable than what it looks like. So we are lucky to be able to have the cappers, although our face shields are running low. So originally, I don't think we don't have enough. We do have enough, but we don't have enough. So they are usually with the face shield, we are supposed to change them between every time we go into a patient room.
Hmm.
So if I have two patients in the ICU, I go into patient room A, I have my face shield. Well, originally I take that face shield off, I toss it, and I put on a new face shield to go into patient room B. And so on, and you do that for the whole night. You take it off and change it. Well, now you have one face shield, and it's not even per shift, it's one face shield that you keep however long until it becomes corroded. So if my face shield is intact for 5 shifts, then I'm going to be keeping that same face shield for 5 shifts. And they will not give me another face shield until that one is torn. So when I go between patient A and B, I now have to bleach it. So when I take it off, I have to bleach it on both sides, and then I save it again. I go in the next room. I come out. I have to bleach it. So we are reusing our face shields.
Hmm.
The N95s, we finally, it's another type of mask that filters out viruses per se. And so that one I have one, and you have to get fit tested to make sure that it's an appropriate fit for your face. Because if not, it doesn't matter if you're wearing it or not. You can still get transmission. So I've gotten one this whole time. I know our hospitals are hoarding them. I don't really quite understand why we can't just have them. It's like tackling. It's a hard thing to do, and so, but I think they're hoarding them until our face shields go away or we don't have enough, and then they'll start dispersing that. But even that, with the N95, you're supposed to put it on when you go into patient A, toss it. Get another one, put it on, and while you go into patient B and toss it. And when they do become available, it's not going to be that way. It's going to be the same thing. They're going to give you one, and you're going to have that one, and you're going to keep it between every patient that you treat. And from there, then again, if unless it's torn or it's weathered, they're not going to give you another one. So
Hmm.
they're like really just they're hoarding the supplies. I am not saying I necessarily disagree with it. I know that there's patients that have to be treated, and if we did it the original way, we would have been out already.
Yeah.
So, like, what do you do? I almost feel like it's like a military type of thing. What do? You're in a code triage situation. You're going to have to make your supplies last the best way possible. So, with your question, we have it. We're not necessarily doing it the correct way, but we're doing what we can. So, I guess I would say the answer is no, we don't have enough PPE when it comes down to it. And we're just managing the best way that we know how.
Mhm. And to connect then with that question, how is the general mood between the staff and your colleagues? Is it like frustration or confusion, or I think it's a lot of stress, I guess. Can you just describe like on a
Yeah,
personal level or interpersonal level between the colleagues?
sure. Gosh, it was very frustrating, like, when this first happened. It was frustrating. I think people get frustrated when they're fearful and if there's no direction, and that's what it was. It was a chaotic mess, and so when you don't have direction because management doesn't know or the CDC and the WHO are changing their shit every single day, of course there's these fears. So then but between, like, my coworkers and I'm fortunate, like, I've been at this hospital a long time, and I'm fortunate that we're friends, we get along. I'm not saying, like, we're perfect, there's definitely frustrating times.
Hmm.
And then we've gotten a lot of traveler nurses, so nurses that come from other states or other cities that have come to help us, which I feel lucky, but, um, with that comes a lot of different personalities.
Yeah, of course.
And, yeah, so I would say the morale is mostly good. Of course, we have our off days, sure, but every time there's been kind of those off situations, we've made amends and we've figured it out, and that really is just about communicating and trying to get to the root of the problem. So I'd say we're doing okay,
Hmm.
but yeah, we definitely have had we've had some issues
Hmm.
here and there.
Uh, I wanted to jump to a bigger question. I don't know. I'm not
Hmm.
sure if you are going to have the answer for it, but I'm just going to ask it. Um, can you describe, or do you know how your hospital, like on that level, on a hospital level, sends its information on cases, death cases, and so on to the government? Is it like, do you send them first to the governor, to the state, or directly to the oh my god, what is it called, the CDC, or
Hmm.
can you describe it, like how do you inform the government about the numbers in your hospital? Because there were some conflicting numbers and reports that came out that the real number of cases isn't this, because they don't include those people, or the real cases of death aren't the real you know what I mean, like.
Hmm. So if we get to the point that we test you, we have our lab courier. They send it to University of Washington Hospital. So that's our big teaching hospital out in the Seattle area. So our lab is actually not through our lab. We send it to their lab. And a lot of the other hospitals are actually sending it to their labs too, because they were I guess, the chosen ones to be able to run these tests. So I don't know the whole answer, but what I do kind of understand is once those tests get processed at the UW lab, they give us a call and they let us know, okay, this patient is positive.
Mhm,
So, from my understanding, once that patient is tested positive, that information goes to the CDC.
mhm, mhm,
So I don't know honestly if it is our hospital that is telling them after we get the results. I think it is the lab when they give us the positive cases. I think that they're the ones that are contacting the CDC. But that's actually a really good question, and I have not thought about that. But they are supposed to. We are supposed to let the CDC know once a positive test comes around. So I don't know if management is the ones that call it in. I don't know if that's actually University of Washington that calls it in.
mhm, mhm,
I'm sorry, I wish I could answer that to the best. But I mean, they are supposed to be any positive test is supposed to be reported to them.
mhm. Okay, I wanted to ask you something because that's concerning for a lot of Europeans.
Mhm.
Uh,
Okay.
we have a big population of smokers here in Europe. You probably
Mhm.
know it, and that's, I think, also the number one reason that people die, like because of lung cancer or something like that, regarding to smoking. And have you treated smokers or vapors? Are the symptoms like more stronger in smokers, or do they really differ from person to person, or do you see there a correlation or something like that?
I haven't noticed a strong correlation. Of course, we ask them, do you smoke pot? Do you smoke cigarettes? It's a question. But as far as the patients that I see passing away and stuff, that isn't their hugest factor. The hugest factor I'm seeing is just their lifestyle. Are they healthy in general? You do have your smokers, and of course, it affects your lungs. But are they healthy? Are they healthy? How long have they been smoking? Is it someone that smoked for like a year? Is it someone that's been smoking for 50 years and has already caused a lot of damage to their lungs? So then we look at, or do they have COPD at this time? Has the smoking caused symptoms like heart failure? Like, so so I'm trying to say, like, are you smoking, but it hasn't caused effects quite yet? Or are you smoking 50 years down the line and it's caused these other underlying issues? So if it's caused like if you're at the point where you have COPD or heart failure because of smoking, then yeah, I mean, then that's when, we can start talking. But it doesn't mean that you necessarily get COPD or heart failure from smoking, if that makes sense. So I'm from our hospital, we're seeing people that have underlying issues no matter what, whether they're obese. Obesity is a huge one. Being overweight, um, they just have too much strain on their hearts and their lungs. And so I'm not seeing those type of patients live too long. If you have any type of lung issue, interstitial lung disease, that type of thing, I don't see them doing very well also. But then you sometimes just get your 30, 40, 50-year old and they have nothing wrong with them. And I'm seeing them pass away from things too.
Hmm.
So smoking I feel like it can be influenced, but I'm only seeing it like if it starts affecting stuff, which
Hmm.
can take years.
Yeah.
And I think I mean, yeah, of course, smoking is something I can't knock it. I used to be a smoker too. So, but I think if you can try to quit, it's definitely a good time to try to
Yeah,
quit.
definitely.
um, Yeah, so like I said, I mean, I've had some patients we've had to intubate like 50-year-olds and they don't have a health history. And maybe they don't have a health history because a lot of our patients are poor where I'm at, and a lot of them don't normally go to a doctor like on an annual basis or get their checkups. So I'm not sure if they did have underlying issues necessarily and then ended up here or not. It's kind of hard to prove that just because they don't have a health history and stuff because they don't go to the doctor until they end up with us. But
Yeah.
um, underlying issues is a big one. If you have kidney disease, that's bad. If you have heart failures, that is bad, and most likely you're going to end up intubated. And the thing is once you're intubated, it's hard to get those patients off of breathing tubes. It's almost like a death sentence after there, and that's just my hospital speaking. Okay.
Hmm.
But the whole time that we've had COVID positive patients in our ICU, we have only extubated 2. So once they're on a
Oh my
breathing tube,
God.
we've only gotten 2 patients off the breathing tube. The rest, they're not weaning, we can't get them down. And so then we have to talk more, like, are they going to be able to get a trach, or, but a lot of them, they're not breathing because they're getting worse. The pneumonias are overdoing their lungs. And then we're also seeing that um, COVID is starting to affect hearts more than anything. So it's not just
Mhm.
breathing, but it's almost like they're getting some type of infection around their heart, which causes them to have heart failure, which means their heart is not able to, keep up with the supply of the body. And so they're getting into these heart failure. These healthy hearts are getting into heart failure, and so their hearts can't keep up. And so a lot of them are dying from that. It's crazy. I mean, we didn't know. Like, this is kind of like new stuff. We're just noticing it with the patients. It's like they come in healthy, they are on breathing tubes, they're not breathing, but now their hearts are now being affected. And then they are also going into a kidney disease. So the kidneys are fine, and then all of a sudden they're needing dialysis, emergent dialysis. So COVID is affecting, from what we see, more than just the lungs. And
So
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 it's
it's mostly lungs, the heart, and the kidney.
It's lungs probably primarily, and then heart we're seeing, and kidneys. Yeah, these patients are having to start dialysis. So
So, hey, you say infection of the heart. So it's something like endocarditis or pericarditis then.
no, okay. So I would say it's like cardiomyopathy. So we
Okay.
do kind of see a little bit of infection happening, but it's mostly heart failure is what we're seeing that's happening. So your heart functions at a 60% level, and that's kind of the normal 60 to 70%. These patients with that had good hearts are now, their hearts are going down to 20%, or they're working at 15%, and it's like over days. It's fast.
So potentially, if you do survive that, you will have to get put on a transplant list eventually. Yeah.
um See, this is brand new to us, because the ones that are developing that are dying.
Damn.
They're dying. So I mean, I don't even know if we could actually. There's one case in particular, this 54-year-old guy. I mean, he was in our ICU for, I want to say, about a month, maybe 5 weeks. He was our very first COVID case. So he was our first one we were actually able to extubate, take out the breathing tube. But with him, he started having heart failure. So his heart wasn't functioning to the normal. And when that happens, when your heart is not functioning to the normal level, you start building that fluid in your body. So
Yep.
your whole body blows up like a balloon, your heart's working overtime. Um, you start getting sepsis. So sepsis is like the damage of like an organ at a time. So first is your lung, which causes damage to your heart, which starts causing damage to your kidneys, because your circulatory system is not moving at that point. But with him, I don't know why he's so lucky. I mean, he's still in our hospital, he's talking and stuff, he's breathing. I still think he's on some oxygen, but he's not requiring a breathing tube. He's the only case that I've seen so far where he's had the heart failure, the kidney stuff, and he's living. So in that case, I haven't seen him, just because I work in ICU and he's gotten better. But
That's
I'm gonna guess that he's gonna have to start, for heart failure, you treat it with diuretics. So medicine that you take every single day for the rest of your life to get that fluid out, because your body is not able to take it out anymore because your heart's not functioning. And your heart doesn't always, I mean, it can reverse a tad bit, but it'll never be the same. So maybe down the line he might need a heart or a kidney transplant, or he might have to continue on dialysis for the rest of his life.
oh, and that sucks. That
It
sucks.
sucks. It's a horrible virus. It's a horrible virus if it gets to that point.
Uh,
But the biggest concern I have with it is, I feel like maybe some of it can be catapulted if we get more of these testing. I feel like the average person that says, "Hey, I have a cold, I'm concerned about it," and we turn them away because they're not sick enough, I think that patient should be tested.
Yeah.
of
Like, I
course.
don't feel like it has to be a pick and freaking choose here.
No,
It's like, this patient
anybody who
came
comes in,
in,
even if they're not
they're
showing
fine.
symptoms of shit, should be tested. Period. If they're
You should be
scared, test them.
tested. It's just like you go to your annual visits. You could be healthy or somewhat healthy, and you go in there and you talk to your doctor to start preventing things from happening. It's the same thing with COVID tests. Okay, fine. They're not in our ICU right now, but in 2 days they fucking can be. And so it's like, test the motherfuckers. You know what I mean? Test them. Test them. Who cares if they're, we all know that a patient can come in one day and in 24 hours they can be intubated. So why not test them?
I agree. I
Just
agree.
because they're walking healthy right now in front of our eyes does not mean in one day it could change. It's a fast moving process that's going on.
Okay, so yeah, and serious. And so okay, I have seen several protests over the last week or so where there are
Hmm.
people out shouting, sharing a bullhorn, um, doing stupid things in my opinion. They're not wearing any PPE at all. Um,
Wow.
Hearing this just screams to me, hey, stupid people out there, this is real. And we need you to take notice. Not to protect yourself, but how about to protect others from you? Because I know you
Hmm.
never want to hurt anybody. So prove it by putting a fucking mask on.
Hmm.
Not that hard, and it's not asking that much. Hey
It's not.
guys, so I found the private chat. I'm a genius. Over on the right, if you go 4 buttons down on the far right, it says private chat. If you click that,
Okay.
we can type privately back and forth to each other, and it'll create less editing.
Oh.
I'm gonna ignore it because my laptop is so old and slow. So I'm too,
So okay,
two can
yeah, no,
write between each other. I'm just gonna ignore it.
Okay.
well, we can talk about you then. Okay, so I was gonna have you go over the importance of PPE and what to do
Mhm.
to stay safe, but it's been drilled in our heads enough, and the people who aren't doing it, they're on purpose not doing it. So, in my opinion, they have no respect for other people, and they really don't care what they bring home to their families.
I mean, some people don't care, but have you actually tried to like look for masks, right? At least over in the Seattle area.
Yeah, we have masks here, and we have gloves, and
Do you?
they
Okay,
do
so
super
we
short.
don't have masks here. We don't have them. And so, I mean, it's even to the point where I like had to buy some off of Amazon the other day. Thank God they had them. But even that, I'm not going to get them until the end of May or early June.
Wow.
So I don't know. Like, I guess if people are like that in the areas that have the masks, I don't think you have an excuse. I think you need to go buy them. But
Well, I
let's say there's
actually I ordered mine like a while back for my youngest daughter. She's into gaming, rodeo gaming, and she has
uh
a few horses, and she also has asthma. And she gets into that barn and she's around all that dust, and it irritates her lungs. And so I bought her these really cool masks that have these filters that you pop in them, and I decided to go ahead and get one that was similar for AJ, and so we have those.
oh, good,
Um,
good.
and so, and this is before we even knew about the COVID thing at all. I mean, it was before Christmas, I think. When I
Okay.
So we're good there. And then gloves, I've had those, and like because I have a nurse that comes and like helps me out every day. Um,
Okay. So
uh,
she brings them to you.
yeah, her agency provides them, and so I kind of use them when I dye my hair.
Nothing wrong with that.
Because I mean I don't have like any bandaging or anything anymore. I just need help doing certain things I can't do for myself anymore. I just my house, the way that my house is made, I can't. I need help.
Sure.
But let's see. Um,
At,
oh,
at our place in Austria, when the news came that maybe masks are going to be short, is she gone?
no, she's here.
Uh
Oh
huh.
wait, no, yep, she dropped out. She'll come back.
Uh huh. Should we wait for?
She probably. Well, we can bullshit and wait for her. Yeah, because I got questions. Damn it.
Me too.
I've been drinking. Shh, don't tell anybody. Mm. It is so late here. Oh my god.
Here it's early. It's 10 in the morning.
Yay, you're back.
Okay, sorry about that. I must have clicked a button.
Uh, I just wanted to tell you the story with Austria. When the whole thing started or came to Europe, and everybody was like already talking about that masks are going to be short, you won't be able to buy them and so on. So almost all the moms and the grandmas started to make them by themselves.
Hmm.
So actually we got our masks from our neighbor's mom. So
Oh,
it's like
that's nice.
everybody's just like making masks themselves. So we
Yeah,
don't
that
have
is
a shortage of masks.
Oh, so that many people are making them. That's amazing.
Yeah, everybody's making for
That's
themselves and
amazing.
for the neighbors and yeah. But okay, Noli, do you want to continue or?
yeah, let me
Uh,
get my questions out.
So, I mean, Nicole, I also think like, I think you have a point. I do think that they should be stricter on it. I think that if it's not made available, like somehow they need to be made available. I was just saying here, the medical stores are tapped, the Target's tapped, all those places are tapped. They don't have them. So what do you do? Does that mean that you should be staying at home? But I do think that it does need to be regulated more because you go out your house, you go to the grocery store, there's definitely people without masks in there. And it's kind of insulting, but in the same way, I know they're not available, but are they just doing it because they don't want to? Because again, kind of like what he was
Everybody's
saying,
got to
like
start.
people are making masks if they need them too. So can you find someone to make masks for you? But I do think that it should be stricter for sure because you don't want to have this or pass it on.
Exactly. And the thing is with it not showing symptoms for a good week or so, but you're still communicable.
Yeah,
That's horrifying.
it
You could give it
is.
to your grandma. You could give it to your newborn. You know, it's
Yeah.
and I also saw a study, like a report or something like that. It took into consideration like the I don't know how to say it, but like effectiveness of government or something like that. And
Hmm.
like Austria and Germany are like the people when the government says wear masks, everybody will wear masks. Like okay, the
so
government
nobody
said,
says fuck you.
and and Austria and the US is like like yeah the government yeah they can say whatever they want like and I
They
think
can say it and we'll think about doing it.
yeah
That's
yeah
kind
yeah
of our
We
our
might
thing
if we
here.
get beaten by the cops, but not until then. Sorry.
And it's true, but I also don't think many people are not everyone's taking it seriously too. I don't think
There are
they are.
people who truly are just like dead set on it's fake. It is all fake. There
Hmm.
are show me the names of people who have died. And I'm just like, are you kidding me? All you gotta do is look it up. There's been famous people that have had it and have died from it. Why don't you look that up? I'm not gonna give you names to nobody
You
because
don't have to give names.
I
if
know a
you do
few
your
names
research,
personally
it's
who have
easy.
lost their lives to it, and
Mhm.
it's disturbing. And the way that people are just so callous and fucking disgusting about it really it hurts my feelings and it pisses me off.
And it should piss people off too because it's like that person can be transmitting it. They have no idea. Like I have a girlfriend, her husband ended up contracting it. He came to our hospital. Thank goodness he ended up getting discharged, but he got pretty sick and they were doing the quarantine thing. They were staying home, but then his son came into town and his son I think lives in New Zealand and
Oh,
he went and visited him and then he came back and he was sick.
oh my
So
god.
it was like one encounter. He had been doing the right thing, but he didn't have a mat. He was doing the right thing, and then he wanted to visit his son. I'm not saying his son got it, but whatever they did together or whoever they were with, he ended up contracting it at that point. And it's like, would he have gotten it if he was wearing a mask? Would he have gotten it if he just didn't choose to see the person?
hmm
Yeah, that's another question that I have is so once you have been diagnosed with it and you go through the motions of the active symptoms, when are you no longer contagious?
That's another good question.
yeah
Like I've heard people, who tested negative after being sick with it, tested negative, and then have like relapsed.
So, and that's what a big question is like once you get it, can you get it again? That's a big question. But also, so I still think that's like in the process of figuring out, but any patient that gets discharged, at least from us, they're told to be on quarantine for 14 days. So 2 weeks period minimum. And I'm hoping that they retest before they they're allowed to like leave the room or whatever, or go back to the grocery stores and whatnot. But right now it's a typical 14 days
Okay. Now
if
with,
you're
with
tested.
China has been dealing with this for quite some time now. Um,
Mm-hmm.
and you would think that this is all information that they would have. They would know this stuff for a fact. But instead, they blow up a hotel room or a hotel building with, hundreds of people that are in it that are all sick with COVID. And that's how they deal with it. Oh, sorry. Did I say that?
You said it.
Right, nothing. A building does not fall flat like a pancake because it is unstable building. It doesn't. Part of the building will fall, part of it will stay up. The only
Mm-hmm.
reason that a building is going to fall flat all the way across like that is if it was demoed. But that's
So
but what do you think about them withholding information? Clearly, they are. They know more than we do, and you think that they would be sharing that information with us so that we can stop this?
that's what I don't understand is like why are they not sharing? I don't know why. I have no answers for that.
Well, but what do you think about it? How do you feel about it?
How do I feel about it? Do I think they're withholding information?
Yeah.
I guess it just makes me think like why the first thing that comes to my mind is why would they be withholding information? That's the first thing. Um I don't have an answer for that. I mean we've obviously seen their battle for the last few months, and then they're saying things are better. I mean, why would they lie about it? I honestly have no idea. I kind of think that they're not withholding. I think they're being truthful in a way. Um, I don't see what value that does unless it's coming from an economical, standpoint. Is it because they've lost so much money that they just want to start rebuilding? Or, are they, it's a good question. I wish I can give you the answer for that, and I don't have one. But,
Can I
um,
connect to that question?
yeah, please.
How is the cooperation with Europe, with different European countries? The flow of
How's the US?
information, and I don't know, and that stuff. How is the flow of information between the US and Europe?
That's a good question too. I don't know. I don't know.
Mhm.
Now you guys are making me think. I don't know. I mean, I honestly don't know. Like, especially like what's the communication with like Italy and stuff. As far as I'm concerned, I don't think they have like high communication with the other countries, even Wuhan and stuff. They don't. I don't know why.
Well, I mean, look at who our president is. I mean,
I
that's
know. Is it ever coming down to a personal level? Like they just don't like us that much. They don't want to give us the information. I mean, does it come down to
well,
that?
when our heads of state and our delegates who are the ones who are supposed to be getting this information are
Mm-hmm.
shitty, horrible people that
They're
nobody wants
horrible.
to mess with them. I mean, nobody even wants to have a conversation with them over the phone.
I know.
I mean, how many times I'm sure have the leaders of other countries been like, I'm washing my hair, tell them I'll call them back. You know?
But yeah, like why is that? It's like this pandemic is happening, and why do they not want to talk to us about it? Do they want to see us fail over here? It could be.
Well,
That's
and America as a whole needs a kick in the ass.
Yeah, I know.
We
I
really
know.
now as individuals, no, we do not. Individuals
No.
are wonderful, but as a whole, we are a horrible fucking country.
I
Our
mean, even our governors are having trouble with our president. The governors of every state are having, I mean, if the president don't like them, he doesn't really want to deal with them. And he made comments about that before. Even our governor, Governor
he
Inslee,
said Washington will be last on the list. Thank you.
because he doesn't like Inslee. And it's so I'm like, why is this like a personal thing? Like this needs to be professional, whether you guys like each other or not. We have people dying over here and people infected. why are you acting callous like that? So, I mean, I guess if it's even happening internal within our 50 states, I mean, maybe yeah, that could be another reason they don't like us, you know?
I have two questions. Can I
Mhm.
ask you?
Yeah.
Uh,
Yeah, definitely.
okay, so the first one is, uh, like for me as a European, it's kind of the private health system that you have. It's kind of completely confusing for me. But the thing to say it in mild terms. But okay, we know. Okay, everybody talks about the tests, and everybody knows
Mhm.
the tests are free.
Mhm.
So I mean free, paid by the government. But what's
Mhm.
with the treatment? Nobody's talking about the treatment. Is it also paid, or does it go to the individual to pay it? How much are approximately the costs? Because it's a new thing, relatively new thing.
Mhm.
So, do you have any information on that?
I mean, I think our patients are getting billed on individually.
Yeah, and the thing is they're not supposed to be getting billed. I can't remember who it was. It was one of our female representatives, but from what state I don't remember. Was all over.
Katie
Was all
Porter, or
yeah,
from
yeah.
California.
So yeah, she was just like, no, you're gonna give me a yes or no. You're not gonna beat around the bush. I already told you I'm gonna ask you this question yesterday. You should be prepared for it. Are you going to
Mhm.
pay for this? Yes or no? Don't give me nothing but a yes or no. And he said, in the end, he said, yes, yes, we
Yeah,
will. We
yeah,
will.
but
It
but
will be
but
free.
she asked him for the tests, not for the treatment.
No, she asked for treatment and everything.
Oh, really?
Yeah. So I don't know. We need to do something about those people too. Big pharma's got to go.
Yeah, I wanted to ask you, do you know approximately the bill, how they look like? Is it 10,000 or
Oh God,
$100 or
It's way more than that. If you end
it's
up
got
in
to
the
be in the hundreds.
ICU, I mean, that could be like 20,000 a day.
oh my
It's not as much for
God.
the people it's not as much for the people that, don't get there, but I mean, they're billing insurance, so I haven't heard of government help from my standpoint.
Hmm.
So, like I said, I think they're all billed, like, with their Medicare, Medicaid, if they have it, or their private insurance.
See
So
now, and so many people. We have so many uninsured people in this country.
We do.
uh,
So, if that's the case, what's gonna happen? They're gonna still get billed. Of course, they have financial assistance programs for people that are poor or don't have insurance. I don't
You
know
don't
how
even
much it
have to be poor to
covers.
not be able to afford this. I mean, holy shit, this is
Yeah.
it costs you more than your home.
Yes, yes, absolutely. I mean, they can end up having $50,000 bills or $100,000 bills at the end of it for sure.
I think that that
So,
that that the costs of the treatment are going to affect the economy more than the, I don't know, a month or two of not going to work,
oh
because
yeah,
those people are going to lose their homes, their cars, everything, probably because of the bills.
that's another thing to think about. Like after all this, what's going to happen? I mean, the economy is already what it is, and it's going to be way worse. And again, people are losing their jobs. So does that mean they're going to start losing coverage? And people have already lost coverage. So a lot of people that have lost their jobs we have a thing called like a health plan finder, Obamacare, Trump care thing. And so a lot of people have been signing up to that to get health care while they're in between jobs. And that would be the smart thing to do to at least have some type of insurance coverage if they do that. But I definitely think they're being billed on an individual level. I haven't heard anything about government assistance in this.
Hmm. Hmm.
That's scary. That's
It's
scary. That's
dead
wrong.
serious.
And it's
Yeah, and,
wrong.
and and imagine that he gets a bill of, I don't know, $100,000 or something ridiculous like that, and he comes
Mm-hmm.
out and you said that some organs can be damaged for the rest of the life. So the question is, can he also find, like he's probably going to need to take medicine for the rest of his life, or maybe he cannot
Mm-hmm.
choose between all the jobs that he could prior to that. So
That's true. That's absolutely true. Wow. Yeah, I haven't really thought that far into it, but yeah, definitely.
Yeah, this
Definitely.
is
He'll
true.
be on
That
a
is
treatment plan for
devastating.
the rest of his life if they make it out of there once they get that sick.
Wow, that's really,
That's
really scary.
astronomical. Yeah, it's gonna be really fucked, honestly. I mean,
yeah.
yeah. So another concern, and then what's gonna happen from there? And that's another thing. Like the U.S. took out like $1 trillion loan thing, so everyone in the U.S. is receiving $1,200 or whatever, and plus another $500 if you have a kid or per kid and stuff. And it's a one-time thing, but that money amounts from the $1 trillion loan that they're taking out to less than 10% of it. So if every American citizen got $1,200 on average, if they don't make over $100,000 and they're getting it, it adds up to less than 9% of that $1 trillion. The other money is going towards businesses, whatever, to keep them afloat. But why isn't that money being saved on reserve for, patient outcomes, patient treatment too? And I don't think there's any money allotted for that.
I
It's
want to know
mostly
why the
the
millionaires and the billionaires are getting on average
I
$1.7 million
I
apiece.
know.
What the
Did
fuck
you
is
hear
that?
that? Is that
What the
crazy?
fuck is that?
Isn't that's insane? It's insane. It's insane. It's like that money needed to be divvied out a lot better. And I think that the citizens should have
A
got
millionaire
more
and
of
a
that
billionaire
money
don't
because
need a dime. They don't
they
need
don't need
a
it.
fucking thing.
And $1,200 honestly is pretty freaking pathetic.
That's
I
not
mean,
even most people's rent.
it's not even definitely not. And like, what if you are the husband of a family of four, the wife isn't working because he's making the
Yeah.
money. Like, what is that 12 or maybe $2,000 after the children? What is that going to do for them times one? They need to pay their mortgage, they need to pay their bills, they need food on the freaking table. I think it's pathetic where the other 90% isn't there geared to help the individual American family, at all, or just the individual American.
Well, I'm part of rent strike, but I'm part of the rent strike that's also like all mortgages and all rents need to be frozen. And
Mhm.
not just frozen in the amount, but frozen as in we are at a standstill, ain't nobody paying rent, ain't nobody paying mortgage until this is done and over with. And not until a month after it's done and over with, because people are gonna have to go back to work and earn that
Mhm.
first paycheck and get the ball rolling again.
Mhm. I have
Um,
an absolute agreement with that.
Or just
and
if
I've seen a few property owners, one in New York City, which just blows me away because they're all slumlords. Uh, but no, he owns like 80 some units, and he actually has told his renters, even the ones who are still working, nobody's paying nothing until this is over.
Oh, wow.
I've got this.
Wow.
Yeah. Now that dude
Wow.
deserves a $1.7 million.
Yes, yes. I mean, it's true though. Like none of that money is going towards any of that. So,
Exactly. I mean, even if he owns all the property outright already because it belonged to his family or whatever, it doesn't matter. Doing that, um, like, God bless that man.
I
God bless
know.
that man and forgive him for anything he's done. I don't care what it is. Like, and I'm not one who says that. There are
Mhm.
certain people, in my opinion, that don't deserve forgiveness. They shouldn't have forgiveness, and they should burn forever.
but if you think it also in a I don't know, marketing way, whatever, the people who are renting his apartments right now and that got that relief that he said, okay, you don't need to pay this month, whatever, they're probably going to be so grateful that they're going to stay, I don't know, a few months longer or a year or something like that. And
Oh yeah,
Definitely.
I would never move. I would
and
stick
he
with him
also
until I
got
die.
and he also got free press probably because of that. So
He probably
It was
did.
literally a blip on the news. It was probably a 35-second piece, and that's it.
yeah.
So
Wow.
yeah, it really, and it's whenever somebody does lead by example. Have you ever noticed that that's all they get is a 35-second blip on the news?
Mhm.
Mm.
Yeah, because I mean, I definitely haven't heard of anything like that here. So
Yeah. Oh no,
that's
I got a letter in the mail a couple of days ago from the property management place that I rent from, and I've been renting from them for 7 years. 2 different places, 3 different places. Excuse me. Um, so 8 years now. But
mm-hmm.
they worded it really. They were really careful on how they worded it, but it was specific. Basically, you have to pay rent this month.
Mm,
And if you don't, there's going to be consequences, even though we can't dish out the consequences right now. As soon as this moratorium is lifted, we will be dishing out those consequences.
wow.
But it was worded in a way to where, you could turn it into the AG's office, but I don't think they would actually do anything about it because they would read it at surface level instead of in between the lines.
Mm-hmm.
But if you know the woman, you know that, these people are not.
Hey, also a question. As I told you,
I
like,
mean, that's a huge concern.
uh, I have a question.
Go
Um,
ahead.
uh, as I
Mhm.
told you, like, I'm totally confused with your healthcare system, so I don't know how it works.
Yeah.
Um, but uh, did your hospital get like your hospital in particular, did it get more funding or government assistance or something like that, like support from the either
Yeah, did
local
hospitals
or
get any grants or anything?
what?
What's that?
Yeah, did hospitals get any grants or anything to kind of help them out?
I don't know 100% sure, but I feel like they did. And the reason why I feel like they did is because, like I said, we have traveler nurses from all over the country that came to help us at our hospital and all over. But at our hospital, they're paying those RNs to come help. They're paying them $6,000 a week per person. That
See,
is
that's
a
bullshit.
that is a lot of cash. And
Because
our
you're getting
hospital,
half that maybe, right?
I'm not getting that. If they're getting $6,000 a week, I'm
And
not
you're
getting
not even getting
anything near
half
that.
that?
No.
So now, so
Yeah,
No.
now
no,
we
that's
now we
bullshit.
know now we know why you want to go to New York.
Yeah, I think you
No,
should.
I
You know what? No, I think
no,
you
that's not the reason I want to go to New
but
York.
but I approve. Now that I've heard that, I approve. You can go.
Actually, they're paying the New York nurses, I think, 10,000 a week.
Yeah,
Then
you can
go,
go.
go, go,
Go
go,
ahead. The
go,
baby will be
go.
fine. The baby will be fine. If you
Can
want,
I go? Can I get a visa?
that's right.
But that makes me think that maybe there is some type of government funding because our hospital, I mean, we're a local hospital. We're not like Harborview and New Job and stuff. And we kind of just been making ends meet. But I know that our boss is like was we have a new boss that just came in right before this happened, and she was really excited about making our hospital a target COVID center. And she's like, "You guys weren't doing very well. We need these patients to come here to make your guys' hospital stand afloat." And she said that. And I'm like, okay. I don't know
What the
why
fuck?
she
Are you
told me
supposed to go
that.
out and grab people off the street and be like, "Oh, you look like you're sick. Come here."
But I'm just saying, and all of a sudden, like, they don't like overtime and all that. But now, like, if you need to stay over, there's no problems. They're not bitching you out because you stayed an extra hour because you needed to help these patients. Where before,
And they better
you know,
not
you
ever again after paying these traveling nurses $6,000 a week.
so that makes me wonder, is it because they're getting more money from these COVID patients because they're charging them, or is it because is it government funding? And I don't know the answer to that. But I mean, there's rumor has it that there is some type of funding because they wouldn't have been able to do it. But I'm not 100% sure because they were really interested in having as many COVID positive patients as possible
Well,
there.
before I let this air, I will pull tax and grant records for your hospital, and I'll pull them for all hospitals in Seattle.
I would love that because I'm guessing there is because that is a lot of money and we have a lot of traveling nurses.
I've been pulling tax records for all sorts of like nonprofits and for
Wow.
businesses. Oh yeah, I've been going nuts. And
Okay.
I went off on Twitter on Dale Earnhardt Jr.'s. He's doing some raffle where you pay $25 for a raffle ticket, and when they do a drawing, he's raffling off his truck and travel trailer.
Mm-hmm.
I
Okay.
went through his tax records.
I mean, I did.
And
Yeah, I would definitely like to know. They don't like telling doctors and nurses bills, so they kind of try to keep it as hush with us because they want us to treat every patient accordingly, no
but
matter
that
what their.
information is all public access. I can log
Well,
in right now actually and get it, but I'd have to. Well, I just all I'd have to do is edit out the name. But I
well, yeah. Let me know because I'm very curious, and I have a feeling they probably are, which they should be if that's the
well,
truth. But I don't know.
we can do like another interview like this after I get all the tax records. Now lately, and I don't know why, but for some reason I'm not getting beyond 2017 with even the nonprofits. Like I think a law has changed somewhere,
Mm,
and I want to know what that law is and who changed it. Because if you are a nonprofit or if you are government funded, we should have instant access. As soon as they file their fucking taxes, we should have access to that fucking information.
yeah. I mean, definitely,
If the public is paying
definitely.
for it or public money is paying for it through the grant system because it's a 501c3,
Mm-hmm.
um, we have every right to see what the fuck's going on in there
Yeah.
and where the money's going and who's doing what. And I think that it is important that all people, sit down once a year even, and whoever it is that they donate to charity, pull their tax
Mm-hmm.
records. Take a look at how much they're really bringing in on charity and how much is really going out on charity, and what
Mm,
they're paying their staff members and if it's reasonable or not for that area. Somebody in my area does not deserve $180,000 a year for meeting once a month.
mm-hmm.
I don't think so.
No,
I'm not okay with that.
I wouldn't be either. I mean, yeah, that's new information. That would be great to find out. Or like I said, it could just be all individual paid, like I'm thinking, and they're just have more money because we're having more COVID positive patients, and they could be charging them up the yin yang.
And
So
that,
I don't
yeah,
know.
that's something with insurance companies. Because of insurance
Mhm.
companies, that is why our cost of healthcare is so high. Because
Exactly.
they can bill these insurance companies these outrageous amounts, and when they get somebody who doesn't have insurance, they still bill an outrageous amount, but it's a little bit lower. Um, if they have state insurance, it's way lower because the government regulates how much they can charge for this or that. But like here in Grace Harbor, I know damn well how long those MRI machines have been sitting there, and I know they've been paid for. They've been paid for
Mhm.
years. So why is somebody still getting charged 15 grand for a single fucking MRI?
Because of our hospital, our healthcare system, it's
Exactly. And
atrocious.
there's greed in the system at every fucking level, and there's money laundering, and there is embezzlement at every fucking level. Every business I have looked into,
Mm-hmm.
their tax information is fishy. I mean fishy. Some of it, there's so many blank spaces that I don't even know how the hell the IRS was like, oh, yep, okay. I have no clue.
Yeah, I mean, healthcare is for profit, that's for sure. So
Yes, it is. And the thing is it should not be for profit.
it
It should be
shouldn't.
mandatory health care, not mandatory health insurance.
Yeah, I agree. Kind of like what the other countries are doing. So, I mean, how is it in Austria? Is it government funded?
Yeah. In
It
Austria,
is.
Austria is an kinda an exception, but technically, everybody is covered. So from your birth to your death, you're covered, even if you lose your
Mm-hmm.
job, whatever. But you always contribute to it's um, like the healthcare is in the same kind of category like how do you call it in the US, social security, like
Oh,
pensions.
so you're paying a tax.
Genau, exactly. Genau.
Yeah.
Now I use German. Okay.
Hmm.
Yeah, you pay it through your taxes, and there's a bracket when you receive uh, your paycheck, and there it's like 6% for healthcare. I don't know. I don't know the exact numbers, but 4% to the Social Security or pensions
Hmm.
and so on. And like I can just take my card, like my medical card that you receive from the government, and I can go to any doctor that I want at any time. And
Wow.
but
Mhm.
The common misconception is that everything is government funded. No, you have also a private sector, so private doctors, private dentists, private, I don't know what, whatever. And
Vision and hearing.
yeah, exactly. And if you, I don't know, want a luxurious one bed room when when you're staying in a hospital, then you pay extra. But like,
Okay.
you don't pay if you go to the hospital. But if you
But like,
want,
how much extra? So how much out of pocket if you want a private room?
I don't know,
And
I don't know it exactly. I don't know.
find out for me. Find out for me. Just call the hospital and be like, hey, we might want a private room instead of a shared room. How much is that going to run us per day?
Okay, I
And the
will.
next time we do this, we can discuss it because I'm kind of curious.
But let's say
I'm curious too.
let's say there isn't a big, how to say that, animosity between the private and the public sector in the healthcare system. So let's say I had problems with my wisdom teeth, so I needed to pull them out, like all four of them, because they
Oh,
hurt
Mhm.
and whatever. And there is also publicly funded dentists in Austria, so your taxes go also to the dentists. And I went to the public dentist, and he was saying, okay, those two teeth, two of the four, I can pull out like right now, but the other two need to be operated because they're, like deep down and whatever.
yeah, they haven't
And
surfaced yet.
exactly, and he said, the I don't have a operation room for that for the next 1.5 weeks. But
Mhm.
if it really hurts, I will prescribe you anti pain whatever, and
Mhm.
that's like $2 or something like that. And if you think,
Okay.
that you can um, wait for a week and a half, then take those pills and come in a week or so. And okay, and I said okay, and then he said, if you cannot, then don't wait, go to a private one. Like
Mm.
there's no animosity, like, oh, the private sector, or the private sector is going, oh, the public sector. It's like mutual, like the public sector, of course, cannot cover everything at any time and whatever, because you never know, like with this pandemic, at once you have 1,000 cases and you're not prepared. And of course, but and yeah, and after I don't know, 3 or 4 days, I still had the pain, and I went to a private dentist, and he took it the same day out, and it was like, I don't know, 200 euros or something like that.
Really?
Yeah, with
Did he
anesthesia.
remove all four? Did he
With
pull all four?
No, he pulled two, because
The other two.
exactly, because the public dentist pulled the first two that didn't need
Okay.
an operation. And the thing is, it was with anesthesia, with like
Yeah.
a
No. You
normal
are,
operation room, whatever, and it was 200 euros.
so that's like probably
Wow.
250,
And
250, 275 here.
the thing is, when you go to a private doctor or dentist or whatever, and he gives
Mhm.
you the bill, so there's always like a uh, how much it approximately costs for the public sector. So let's say uh, in a at a public dentist, to take out one teeth costs, let's say, $50, but at a private one
Mhm.
it costs $100. So you can actually go with that bill to your local government and get that difference of $50 reimbursed.
That's amazing. That's
Right?
amazing.
That is fucking phenomenal.
Yeah.
So the patient gets his coverage or whatever. The private sector gets paid, and the public sector doesn't get overloaded.
Hey, I have a viewer question for both of you because I got a text message from my buddy Otto.
Mhm.
Uh, he he has a question for both of you.
Okay.
Yeah.
Is shit fucked up and stuff over there too?
What?
Is shit fucked up and stuff over there too?
In Austria?
Yeah.
No, everybody's chilling. Everybody's taking everybody's, like, we take it seriously. With we socially distance and everything what the government says we do, like wearing masks and everything. But why get stressed out? Like,
Are you involved in those outside dance parties in the morning that have been going on?
no.
No. Why
No. I don't want to
not?
take
He
the
said
risk.
no.
I had to ask because I know that he will listen to this.
That's smart though.
So hey, I asked you earlier if you would explain um a little something about the cold virus, the common cold virus, which is rhinovirus, um,
Mhm.
rhinitis, and the influenza, which is the flu, and
Mhm.
COVID, and how they are not the same. There's one thing that makes them the same. Could them words come out of your mouth?
Yeah, I can. So I mean, like you said, you have the rhinovirus, you have influenza, and then you have COVID-19, what we're dealing with now, and
And
they're not related at all, especially the rhinovirus, the common cold. So I know you sent me that little YouTube earlier with that cop saying that, but I mean, it's not a cold. You don't die from the cold, you know. Whereas influenza, yeah, you can die from it. Most people don't, but I mean, influenza is its own virus, and the COVID is its own virus. So
yeah,
the
the only
cold is
thing that
not
makes it
related to the COVID at all. You don't get a cold and then all of a sudden your whole system flushes down like COVID, you know,
yeah.
or even influenza. Influenza can happen a little bit, possibly, but not as much as COVID. COVID is like the real deal. It's causing sepsis, it's causing multi organ system failure. People are dying from it. We don't have to put people on a breathing machine because of a damn cold. So there's a definite difference between all three of those viruses.
Thank you so much. I really just
You're welcome.
need somebody with medical credentials to say, hey, this is because I've been screaming it for weeks now. Telling people, listen, this COVID is not a cold. Why do people keep saying it's the same thing as a common cold? It's not. Just look it up. I mean, type in, any medical school and then type in definitions and common cold and then
You
type
probably just Google it and find that out, you know?
well,
But
Yeah,
with
that's
Googling it,
funny how.
you have to like actually search a little bit because there's a lot of misinformation popping up right away with Google even, which is really pissing
oh,
me off. Um,
okay.
People needs to be more responsible with the information, and
Mhm.
our same with our reporters, our journalists. I think there should be a penalty for knowingly printing a lie
Mhm.
or knowingly withholding information. I think that there needs to be a penalty for that. I think that uh, uh, magazines like the National Enquirer or whatever, um,
Mhm.
like there is a freedom of speech, yes, but that doesn't mean you have the freedom to lie and do harm to the public. I think that's
I think that people are downplaying it to not freak people out, but I do think that I mean they should definitely tell the real deal on all of those things. So,
there's a large amount of our population who is just livid because they are scared to death that their families are not going to have a home. They're not going to have a meal to eat tomorrow. They're not going to have their car tomorrow. They are not going to be able to survive on their own. And
mhm.
the life as they know it will never be the same again.
Hey
Um,
girls, I need to disappoint you, but I need to go.
well, bye.
Okay, have fun
Well,
for the rest of the
thank
interview.
you.
Thank you so much that you participated, and
Mwah.
stay safe, girls.
Yes,
Okay?
and
We will.
have you got this recorded on your end already, or do I need to send you a copy?
You can send me a copy. I recorded it with OBS, but I don't
Okay,
know if it works.
let
But
me know how it turns out.
yeah, okay,
And if it doesn't turn out, then I will forward you a copy.
perfect.
All right, we'll talk to you later.
Yeah,
It's
ciao.
nice meeting you. Yeah,
Bye.
be safe.
Stay safe. Ciao.
Bye
Thank
bye.
you.